Okay. Hello. My name is Christian Ocampo. I'll be doing my video validation on venous ventral line dressing change. And before we begin, I just want to let you know about 7 steps that you should do before interacting with your patient. First one is you're going to identify your patient and you're going to introduce yourself to said patient. You're going to wash your hands. You're gonna check the physician's orders. You're gonna provide for privacy. Wash your hands and gather your equipment. Alright, so before we begin, just want to let you know that the bed's already up at my working height and my side rail is already down, and because I'm here, it's still safe. Brakes are locked, all that stuff. Want to make sure that our patient's comfortable. You know, she's A-okay. She's aware that I'm going to be doing the procedure. And you also want to instruct your patient that not to touch any of the sterile fields that I'm going to be setting up in the future, as well as not make any big movements that could, you know, ruin sterility. Okay. So first things first, you know, I'm gonna don on some clean gloves.
It's because she's cracking jokes and laughing by herself.
Like so. One. Okay. So first step, we're gonna take a look at our ventral line dressing, and it actually looks like it's coming off, so it's actually a good time to change it. So you want to make sure what the skin looks like, when was it last changed, at what time was it done, if there's any if there's any drainage, if there's a potential infection. You know, you can do that right then and there if you can see right through the transparent dressing. So our next step, that we're just going to slowly peel this off gently. It's, you know, it's adhesive, so it's, think of it as like you're removing tape off of someone, so you want to make sure. Okay. Yikes. Yeah, it's a good thing we're changing this dressing, alright? So normally this central line dressing, you're gonna see like some stitches or like some sort of anchor right onto these holes here, and that's supposed to be attached directly onto the skin. Normally a resident or a fellow would be in charge of that. That's usually done at the time of this. Okay. Gonna try that. Next, I'm just gonna open up my central line tray real quick. Now everything in this bag is sterile, so since I still have clean gloves, I don't want to touch everything just yet. I'm gonna try and get stuff out. Not making sure.
No, there's no writing.
There's like a writing and like there's like a language portion where you have to read. And
Now since there's only one mask in here,
but like I think there was like an English section and then separately
since there's only one mask in here, that's gonna go on me. If I have 2, one's gonna go on myself, and then it's on the patient. But since I only have one, I'm gonna instruct my patient to turn her head off to the side, and her head's already off to the side. Great. With that, you normally get some sterile gloves, but since these are too small, I have my own ready to go. I'm just gonna remove my gloves. Just going to wear the mask on myself. Pinch, bring it over. Just gonna open this real quick. And then, since I removed my old gloves, it's a good idea to wash your hands before applying the sterile gloves. So, wash your hands, or what's that called? Some hand sanitizer would be just fine.
And then when I got the letter,
pick.
They told
So also note that you should also have some sort of like trash bag or waste basket near your working area. So, one. So, I already washed my hands, whatnot. Now we're just going to wear this. So since I'm grabbing it by the cuff, just gonna put on my step gloves real quick. Just like so. Next glove. So before you put on your sterile gloves, you want to make sure if your pigeon has any allergies to latex. Some sterile gloves are made out of latex, and you just want to make sure that you don't give them an allergic reaction just because you were just trying to get some sterility into the procedure. Now, everything's still sterile. Gonna remove that. Gonna put that off to the side. Next, I'm just gonna this. Since it's still sterile, since the entire package is sterile, quickly about that, like so. Next, we're gonna get our Chloro applicator, and you all, depending on how the dressing was, if there's like some drainage, you're gonna use your gauze to like just soak it up and note the drainage. Okay. So with this, we're just gonna break, just like so. Now we're gonna go in two motions. We're gonna go vertically and horizontally. So we're just gonna go like this. 1, 2, and I should note that the central line should not be moving like this. It would normally be anchored to the skin. Forgive me. Just like so. Like that. And of course, you want to make sure your sterile field is in your line of sight and you don't turn your back on it. So just like that. That right now. Next up, we're just gonna wait for it to dry, and I'm not gonna fan it. I'm not gonna do this because, you know, whatever contaminants in the air, I'm just forcing it on. You don't want to do that. So just wait for it to air dry. Our next step, once it's dry, we're going to take our Tegaderm. You know, has a little transparent window over here. What I'm gonna do, I'm just gonna prep that. Quick. It's gonna expose just half of it for now. Okay. So. Don't get to touch anything. You want to make sure it's flush, and then your lines are right through the middle over there, like so. Just like so. And expose. And then we're just gonna try and get this trying to get this paper off. Okay. So we're just gonna continue. Just going like that. Okay. So we have our dressing right on there. Now, if it isn't, like completely like sealed around the edges, there is a little piece of tape. I mean, I already broke sterility when I touched the patient's gown. You're gonna use some pieces of tape, just to tape around the edges. So, I also want to note that before you apply this on, you should apply some biofilm. That helps it stick better, as well as that when you're removing it, it doesn't like irritate the skin as much. So, just a little tidbit for you guys. So, I'm just gonna use a little bit of tape.
So like I stayed here to like check my end grade, and then she's like, "Oh, I ended up curving
Help seal it,
by 5 points." So I went from like a
because
I ended up passing.
it's not really sealing up here.
I went from like a 78, I think, to like an 82.
So it's like so. All right. So we're just gonna remove our sterile gloves.
I'm so glad I tested everything I'm done.
Like so. Perform hand hygiene once again. We're gonna date, time, and initial our dressing, and then we're gonna have our patient be more comfortable again. So, call bell, side roll back up, bed at lowest position, and then we're just gonna clean up after ourselves and then document how the procedure went and how well the patient tolerated. If there is any drainage, we will note that as well. And that's how you do a sterile venous central line dressing. Thank you.